Hey everyone, it's Kim. Welcome back to Unmasking Mental Health. We are continuing to talk about the things people don't say out loud. Today, we need to talk about the assessment hangover. Now, before we get into the story, I want to be really clear. We know that the professionals on the other side of the desk, whether they are nurses, practitioners, or therapists, are doing their best. We know that mental health services are facing extreme backlogs and low funding. When they make us fill out the forms or go through the triage calls, they aren't trying to make it difficult. They have to do it. They have to make sure they get us to the right team, because the waiting lists can be months or sometimes years long. But two things can be true at the same time. It is true that the system needs these assessments to work. And it is also true that for the patient, for us, the process is exhausting. It is a marathon of opening up your wounds to strangers over and over again, just to get a place in line. I want you to listen to Alex. This is what it feels like to navigate that necessary but brutal process.
I'm sitting in my car. The appointment is over. I should be relieved, right? I finally saw someone. I finally got into the room. But I don't feel relieved. I feel hollowed out. I've been working up to this day for months. It started with that form. You know the one. The questionnaire they send you before they even agree to put you on the list. I sat at my kitchen table 3 months ago, crying over a cup of tea, trying to summarize the worst years of my life into little text boxes. Writing it down felt like cutting myself open. But I did it. I know they need the data to see if I meet the criteria. I sent it off. Then came the phone calls. And that was almost harder. It wasn't just admin. It was a triage assessment. A clinician on the other end of the line who needed to assess my risk. They were kind, they were professional, but they needed to know the details. So I had to stand in my hallway and open up my chest to a stranger on the phone, just to prove I was in the right queue. I remember hanging up that phone and shaking for an hour. I thought, okay, I've done it. I've told them. But then came today, the face-to-face assessment. I walked in there. The practitioner had my form. They had the notes from the phone call. It was right there in front of them. But they looked at me and said, "So, in your own words, tell me why you're here today." And I had to do it all over again. I had to use my voice to say the things I had already painfully written down. I had to watch them type while I described the panic, the sleepless nights, the things I've never told my friends. I felt like I had to perform my pain well enough to convince them that I deserved to be on the waiting list. It's the repetition that kills you. It's the fact that you can't just say, "I'm hurting," once. You have to say it to the form. Then you have to say it to the triage team. Then you have to say it to the assessor. By the time you walk out of that room, you aren't just sad. You're traumatized.